You know, in the high-stakes world of healthcare, every little detail matters. I mean, even down to the order you put your gloves on. Today, we're going to dive into the supercritical system of personal protective equipment, you know it as PPE, and pull back the curtain on the surprisingly clever, pop culture-fueled secret codes that healthcare workers use to get it right every single time.
So I have to ask, how are things you'd find in your living room on a Saturday morning connected to stopping the spread of really serious diseases in a hospital? Well, that's what we're here to solve. It's kind of a mnemonic mystery.
Just look at this. On one hand, you've got the iconic MTV logo, total symbol of 80s and 90s music TV. And on the other, you have this highly controlled, totally sterile medical environment. They seem like they're from different planets, right? But stick with me, because by the end of this, you'll see exactly how one is used to master the other.
Okay, so first things first, let's get on the same page. Personal protective equipment, or PPE, is basically the shield between healthcare workers and any potential germs. And we're not just talking about clothes here. This is a whole system of gowns, gloves, and masks. The purpose is really simple, but it's absolutely vital: to stop infections from spreading.
Now, using all this gear, it's not as simple as just throwing it on. Nope, there's a very strict, very calculated order for putting it on, and that's called donning. The whole sequence is designed to give you maximum protection right from the start.
So, how do you get suited up the right way? Let's walk through the exact procedure for getting in safely.
The whole process kicks off right where it should. Step 1, always, is hand hygiene, clean hands. Then comes the gown, followed by your mask or respirator. After that, it's eye protection, so goggles or a face shield. And the very last thing you put on, the gloves, and you pull them over the cuff of the gown to make a perfect, unbroken seal.
Okay, so you're all suited up. But here's the thing, getting the gear off correctly, which is called doffing, is just as critical. In fact, maybe even more so. This is where the risk of contaminating yourself is the highest, so the order is totally different, and you have to get it right.
The goal here couldn't be more clear. It's time for getting out. And you want to do it without taking any nasty contaminants with you.
The order is almost a complete reverse of putting it on. You start with what's considered the most contaminated, your gloves. They come off first. Then your goggles. Next, the gown is removed, and you do it carefully, rolling it away from your body. After that, the mask comes off. And the final step, you guessed it. It's the same as the very first step of getting in. Really good hand hygiene.
All right, now that we know the how, let's get to the when. See, different illnesses need different levels of protection. And this is where those clever little memory aids we talked about come into play. They help hospital staff remember in an instant which precautions they need to use for which diseases.
So our first category is for germs that can travel through the air, sometimes over pretty long distances. These are some of the most infectious ones out there, and they require special rooms and special handling. So what's the secret to remembering the main airborne diseases? Well, you're not going to find it in a medical textbook. You're going to find it on 80s television.
The mnemonic is just brilliant in its simplicity. MTV. M is for measles, T is for tuberculosis or TB, and V is for varicella, which you probably know as chickenpox. If a patient has one of those, you immediately know airborne precautions. It's simple, it's effective, and you'll never forget it.
Next up, we have droplet precautions. Now, these are for germs that travel in larger particles, usually when someone coughs or sneezes. They don't just hang in the air forever like airborne germs do, but they still need their own specific set of protections.
And remember the pretty long list of diseases that fall under droplet precautions. Healthcare workers don't turn to a textbook. They call in a friendly neighborhood superhero.
And here he is. The mnemonic is Spider-Man. It's fantastic. Each letter stands for a disease or a group of them. You got S for sepsis, scarlet fever, and strep, P for parvovirus, pneumonia, and pertussis, that's whooping cough, I is for influenza, D for diphtheria, E for epiglottitis. I mean, it's a huge list packed into one name you'll never forget. And honestly, my favorite part, the N. It just stands for now repeated twice to help really lock it in your brain. How great is that?
Okay, our last big category is contact precautions. This one is for all the germs that are spread by actually touching a patient or touching things in their room. It means you have to be really diligent with gloves and gowns for any kind of interaction.
And for this one, the memory aid is a person, a very helpful, if imaginary, teacher named Mrs. Wee. And she actually helps you remember two different groups of infections.
The first part of the code is her name, MRSW,
M stands for multi-drug-resistant organisms, R is for respiratory infections, S is for skin infections, W is for wound infections, and the two E's stand for enteric, which means related to the intestines, and eye infections. So her name covers all the big categories for contact transmission.
And for a more specific list of skin infections that need contact precautions, there's another great one, VCHIPS. This covers everything from varicella and herpes to pediculosis, which is just the medical term for lice, and scabies. So between Mrs. Wee and her VCHIPS, you've got a huge range of conditions covered.
Now, all of these specific precautions, airborne, droplet, and contact, they're all layered on top of a foundational principle, a golden rule that applies to every single patient, every single time, no exceptions.
And that rule is called standard precautions. The idea is simple. You treat all body fluids, secretions, and excretions as if they're potentially infectious. It's the universal baseline of safety in any healthcare setting. It's why you always see staff wearing gloves and constantly washing their hands.
And within those standard precautions, there is one action that is absolutely paramount. And there's a really simple rule for how long you should do it.
This might be the most practical piece of advice in this entire explainer. To make sure you're washing your hands for the recommended amount of time, just sing happy birthday to yourself twice. It's a simple, universal timer that makes sure one of the most powerful infection control tools we have is done right every single time.
So from MTV to Spider-Man, these aren't just quirky little memory tricks. They are high-speed cognitive tools that let healthcare workers make the right safety call in a matter of seconds. These codes literally protect our protectors. And it makes you wonder, right? What other invisible systems, mnemonics,